క్లోజ్ చేసింది. Good morning, students. Today we are going to discuss about animal experiments on rabbits. Yesterday we discussed about miotics. Today we will discuss about mydriatic drugs on rabbit eye experiment. Nowadays we cannot do manual experiments on these animals. So we can do by using computerized assisted learning. So we'll see procedure, how we'll do manual, practical, and by using CAL. Introduction. Eye is the one of the organ easily accessible for the study of drugs, study of effects of autonomic drugs, that is either cholinergic or adrenergic drugs applied locally. It is also only place where one visualize naked blood vessels, that is eye, and get useful information regarding the state of vascular system. In eye, two muscles are present, that is circular and radial muscles. These two muscles are rule the size of the pupil size and light reflex. So here you can see in normal light, when you produce in normal light, this is the, here you can see this is the radial muscle, in middle this is the circular muscle. Okay, in normal light we can produce in normal light, these muscles are normal and pupil size like this. Then we can focus our bright light. Here you can see pupil circular muscles are contract and radial muscles are normal in contract in bright light. So when we focus on bright light, pupil immediately constrict the pupil because of contract the circulatory muscles. Like that, here in dim light it opposes the action. So what will happen? The radial muscles are contract and circular muscles are normally normal state and radial muscles contract. What will happen? If radial muscles are dilated muscles contract by innervated by sympathetic nerves, it produces mydriasis. So this is called dilatation of the pupil called mydriasis. Normally they are in a dynamic state of equilibrium. By nature, radial muscles are weaker and circular muscles are stronger. So here you can see this, the radial muscles are also called dilated pupillae and circular muscles are also called constrictor pupillae and sphincter pupillae. So what will happen in mydriasis? Here adrenergic drugs or produces mydriasis by innervated by the sympathetic nerves. It dilates radial muscles or dilated pupillae. It produces mydriasis. For example, adrenergic drugs ephedrine, phenylephrine, and anticholinergic drugs atropine. These drugs are causes mydriasis. Here, increases the pupil size is called mydriasis. This is the meiosis. Constriction of the pupil is called meiosis by pilocarpine. cholinergic drugs and cholinesterases, anticholinesterases. It causes meiosis. Yesterday we discussed about meiosis. So here you can see this is the two muscles are present in the eye, and one more muscle also present in ciliary muscle is also present in the eye. So here you can see this is the meiosis by contraction of the sphincter pupillae. Here you can see mydriasis. This is the dilatation of the dilatation of the pupil due to contraction of the radial muscle or dilated pupil muscle. So it increases the pupil size, is called meiosis. It is innervated by the sympathetic nerves. It is these drugs, sympathetic drugs acts on alpha 1 receptors which is present in the eye. Unlike that, cholinergic drugs acts on M3 receptors which is present on the eye. Like that, ciliary muscles are also innervated by parasympathetic nerve, which also causes meiosis, and it also increases outflow of the aqueous humor, so it reduces intraocular tension. So what are the effect of drugs on rabbit eye? To study the effect of different drugs on rabbit eye, and we have to measure parameters, that is pupil size, whether increased or not, corneal reflex, whether it present or not, light reflex, whether pupil will constrict or not, we have to check, and intraocular pressure, whether it is decreased or not. So these are the parameters we have to check in this practical. So first one, we have to select healthy rabbit and choose conjunctiva is usually thick and clear when eyes are healthy. So which is used in the experiment. So this is the conjunctiva. First we have to select healthy rabbit and see proper conjunctiva is there or not, and changes before and after the drug administration are noted and compared with control. And next parameter is the pupil size. This is the pupil. When we will add drug on this pupil, whether it will increase the size of the pupil or decrease the size of the pupil, we have to check. So the virginal size is measured with the help of the pupillometer. When we measure this size of the pupil, when we will add drug on this, whether either cholinergic drug or adrenergic drug, so it will increase or decrease, we have to measure the size of the pupil. By using pupillometer, it is nothing but a scale-like structure with varying size of round holes. That is 0.5 mm. One division is equal to 1 mm, 2 mm, like that. So it is having starting 0.5 mm, 1 mm, 2 mm, like that. After the drug treatment, change in pupil size is noted. After adding drug, changes will be there in pupil size. And corneal reflex, what will happen in corneal reflex when by using cotton wool, we will touch on the cornea by cornea through sclerocorneal junction. So what will happen? Immediately rabbit is blinking the eye. So this is the corneal reflex. When it blinks, corneal reflex is present. When the cornea is touched with cotton wool on rabbit eye, it closes the eyes. To check this reflex, a cotton tip is prepared and touched at sclerocorneal junction by bringing the corneal tip from the side of the eye. If cornea is desensitized, when it is not when it is desensitized, when local anesthetics will apply, like lignocaine, we will apply on local anesthetics on eye, it will not show any corneal reflex. It will not show any reflexes because of local anesthetics. If cornea is desensitized with local anesthetics, then there will be no corneal reflex. Then light reflex. Light reflex is elicited by pointing the light source on the pupil with the help of the torch. When we focus torch on rabbit eye, immediately it constricts the pupil size. It decreases the pupil size because of M3 receptors. M3 receptors are present in the eye. Because of these receptors. Because of these receptors, constriction of the circular muscle will happen, then constrict the pupil size. So there is a constriction of the pupil when rabbit is kept in a dark area or eye is covered with a cardboard, and the pupil size will be measured. With pupil size will be measured. That theory part, coming into the theory, the eye iris contains two types of smooth muscles. One is the sphincter pupillae and one is the dilator pupillae. Sphincter pupillae is also called circular muscles. Dilator pupillae is also called radial muscles. When sphincter pupillae contraction of sphincter pupillae contracts, sphincter pupillae constricts. Pupil decreases the size of the pupil. When sphincter pupillae radial circular muscles are constricts, so what will happen? Pupil size decreases. It is called meiosis. Then radial muscles or dilator pupillae, contraction of the radial muscle or dilator pupillae. What will happen? It produces dilatation of the pupil size. So it is called mydriasis. Which drugs it causes? Sympathetic drugs and anticholinergic drugs produces mydriasis. And additionally, eye contains ciliary muscles, which also anticholinergic drugs also acts on ciliary muscles. It produces meiosis and also produces accommodation and increases the outflow of aqueous humor and to decreases the intraocular tension. Next, coming to the practical effects of drugs on rabbit eye, that is mydriatic drugs. Yesterday we discussed about meiotic drugs. Then today this practical is about mydriatic drugs, to study the effect of mydriatic drugs on rabbit eye. So students, from here onwards you have to note down in your records effects of drugs on rabbit eye. First one is the aim, to study the effect of mydriatic drugs on rabbit eye. And next, materials requirements. Which materials we want to use for rabbit eye experiments? First, we have to select healthy rabbits and rabbit holder. These are the materials: healthy rabbit holder, torch, dropper, and cotton wool and pupilometer. These are the materials which is used in this practical. So this is the rabbit, this is the rabbit holder, and here you can see torch, this is the cotton wool, this is the scale and dropper. What is the materials required? Rabbit holder, torch, dropper, cotton wool and pupilometer. Here you can see this is the rabbit holder. Then we can keep inside like this. And this is the cotton wool and scissors and torch. We can use in this practical. So other drugs, requirement of drugs, we can use normal saline, atropine or anticholinergic drugs and ephedrine or adrenergic drugs. These drugs produces mydriasis. So coming to the standard operating procedures for preparation of the animal, what are those? Take some healthy rabbits, let them be quiet in laboratory environment. Before taking that, tame the rabbit because it quiet the laboratory environment and trim both eyelashes with the scissors and make the left eye as a control and right eye as a test eye. Always left eye serves as a control and right eye as a test eye. Instill normal saline in both the eyes and record pupil size, light reflex, corneal reflex of the both eyes in it before installing drug. First we have to do what will we have to install normal saline in both eyes before starting practical. Then afterwards record pupil size, light reflex and corneal reflex of both eyes before installing drug. Then instill 2 drops of the given drug into right eye because it will take as a test eye by making pouch with the lower eyelids because it's prevent from the draining of the drug into nasopharynx. So instill 2 drops of drug in the given drops of given drug into the right eye by making pouch with the lower eyelids. The left eye will serve as a control, so install normal saline in it. So it is always left eye serves as a control eye, so we can install normal saline in it, and right eye serves as a test eye. In this eye we can instill given drug. So after instill given drug in right eye, press the medial canthus for 10 seconds to prevent from the draining of the drug into the nasopharynx. Okay. So after installing drug into right eye, press the medial canthus for 10 seconds to prevention from the draining of the drug into the nasopharynx. Then record the pupil size, light reflex, corneal reflex, and every 5 minutes interval till the end of 20 minutes. You have to check every 5 minutes up to 20 minutes and compare with control eye. So this is about standard operating procedures of the animal experiment, rabbit experiments. Then how we do by using Carl experiment nowadays? We cannot do by manual procedures because animal killing is banned nowadays. So we can use Carl computerized assist learning. For this, many websites are there. That is, one is the X Pharma website and another one is the Animal Simulator or computer assisted learning. So we can use this computer assisted learning. By this, using this, we can do these practicals, rabbit eye experiment and frog experiments and frog's heart, isolated heart, and guinea pig ileum practicals and dog experiments. By using this call, we can do all these experiments by using computer assisted learning. So for example, how to do perform? First, if we will go in X Pharma software, we can get like this X Pharma windows. We can like this screen. So in this screen, we can get introduction, history, software. If we will click on this introduction, we will get introduction and install. If we click on instructions, we will get instructions how to do practical like that. And another option is also will be there, tutorials option. When we will click on this tutorials option, then we will get like this screen, tutorial option. When we click on tutorials option, we will get like this screen. So here you can see left side of the top, you can see directions here. Instill drugs one by one and observe their effects on rabbit eye. What is the direction here? Instill drugs one by one and observe their effects on the rabbit eye, then tabulate and data and draw conclusions. So this is the directions. Besides that, you can see here instructions. If you click on these instructions, you will get instructions how to do practical, and every instructions regarding practical you will get. Then besides that, rabbit is here. If you will click on this, first you have to select rabbit here, rabbit 1. Then you will start practical. Then here left side bottom you can see drugs are available here. So then you will click. You will select drug, which drug you want to instill on instill in rabbit eyes. First you have to select here drug name. For example, here epinephrine is there, is an adrenergic drug. So when you will get this drug, if you click on these drugs, so you will get this drug. Then you will choose option this instill drug. Then you will choose when you will if you will choose this instill drug or click on this instill drug, immediately you will get these two eyes. These two eyes, rabbit ice creams, left and right eye. Left eye is always serves as a control eye, which in this eye we will install normal saline. Okay. Then right eye is serves as a test eye. So in this eye we can install this epinephrine. So after install this drug, when we'll press on this, when we'll select the drug, then immediately we will choose this option, instill drug. This instill drug option, when we will select or when we will click on this this option, then immediately you will get these two, left eye and right eye, which eye you want to install. So then you will add in this right eye of the epinephrine drug. So what will happen after installing drug? Immediately pupil size will be increased. So in normal saline there will be no change because of this is the control eye. In left side there is no change because this is the control eye. So right eye, when you will install this drug, epinephrine drug, immediately you will get increase the pupil size. So here this is you can see this is the scale. Both sides are there. This is the scale. You can use, by using this scale you can measure pupil size, whether it is increased or not. Okay. Then afterwards, here you can see intraocular tension. This is the normal intraocular tension. This is the lower intraocular tension. H indicates high intraocular tension because epinephrine drugs decreases the lower intraocular tension. So then here, besides the drugs, here you can see tools. Tools are there by use torch and cotton wool. By using torch, you can check light reflex, and by using cotton wool, you can check corneal reflex. Okay, this is about tools. This is about parameters. And first we have to select rabbit. Then we have to add the drugs. We have to select drugs. Then we have to check. We have to install drug, and we have to check pupil size, and we have to check light reflex and corneal reflex. Here, now that is about tools, and here we can see how we'll do practical. So first, we can select rabbit. Here you can see rabbit 2 because every time we have to select rabbit. Rabbit 1 is for epinephrine. So if you will change another drug, means rabbit also take another rabbit. You can't do in single rabbit. So you have to change rabbit. So take second rabbit, that is rabbit 2, click on here, then you will go for drugs. The drugs are available in left bottom side. So first, so then if you will select drugs, for example, here left side normal silent, you can install both eyes before starting practical, then after 5 minutes you can install atropine. If you will select atropine drug, and select one drug here, then you will go this option instill drug, then you will, if you will click on this instill drug, you will get two rabbit eyes, one is the left eye, one is the right eye. Left eye is always as a control eye and right eye is always we can use as a test eye. So this atropine we can install in right eye. What will happen immediately? You will produce, it will produce mydriasis. Here you can see increases the pupil size. It is called mydriasis. When we will add atropine on this eye, it will produces mydriasis because atropine is a anticholinergic drug. It acts on, it blocks the M3 receptors, so it produces mydriasis. So this is the normal pupil size. How much is the normal pupil size? For example, 6 mm. So here it increases the 8 mm like that. So afterwards we will measure with scale. Drag the scale to pupil and dilate pupil. This you will check with pupilometer of this pupil size. Then you will check afterwards. You will check light reflex by using torch. If you can drag this torch to rabbit eye from back side, then it will, for atropine, what will happen in generally constrict the pupil, it causes meiosis, but here M3 receptors are blocked, so it does not show any light reflex of atropine. So light reflexes absent in mydriasis. Then cotton wool by using corneal reflex by using cotton wool. When you will drag this cotton wool in front of the eye, immediately when you touches the cornea, it blinks in the eye, it closes the rabbit eye, it closes the eye. So this is corneal reflex. Corneal reflex is present in this mydriasis. So and you have to check intraocular tension whether it is increased or not. After atropine drug instilled, intraocular tension is decreased or increased. Okay, this is about call. Then you have to draw table or observation table, and you have to write in that observation table and conclusion and discussion part. So this is about call. Computerized assist learning, how we'll add drugs and we'll see light, we'll check parameters. Those are the light reflexes, the pupil size increase, whether increased or decreased, and we have to check light reflex and corneal reflex. Isn't it? Okay. Then next, procedures. This procedure you have to write in your records. First, we have to tame, select healthy rabbit and tame the rabbit. Then hold the rabbit by its holding the ears with one hand while supporting its bottom with another hand. Like this, we have to hold the rabbit. Okay. And fix the rabbit in rabbit holder. Trim eyelashes by using scissors, since the eyelashes may interfere while administering drugs and corneal reflexes. So we have to trim eyelashes before going to practical with scissors. Take care that the eyes and eyelashes are not injured. And keep one eye as a control, that is the left eye, and another eye is the test eye, and use normal saline as a control. And wash both eyes with a normal saline thoroughly to remove the residual drugs if any installed before. So use the pouch technique to install the drugs in the eye. And press the medial canthus for a minute after installing the drug so that the drug does not escape through lacrimal canal. Measure and elicit the following parameters in the both control and drug treated eyes and tabulated the findings. What are those? You have to measure light reflex, corneal reflex, and pupil size, whether it is increased or not. So this procedure you have to write in your records. And keep the rabbit in rabbit holder such a way. Here you can see this is the rabbit holder, and you can keep like this. That head will be protruding outside. You can keep head will be protruding outside, and consider left eye as a control and right eye as the test eye. In control eye, we can add 2 to 3 drops of normal saline, and in right eye as a test eye, we can instill given drug solution. And you can see light reflexes. It is studied by focusing on touch on the eye and observing whether the pupil is constricted in response to the light or not. What will happen in miotics? This constriction will not be there. So light reflexes is absent because it causes ephedrine, it causes light reflex, but anticholinergic drugs like atropine, it does not show any light reflex because it blocks M3 receptors. So it blocks M3, because of this blocks M3 receptors, it causes dilatation of the pupil. So it does not show any light reflex in atropine of mydriasis. And corneal reflex, this is the cotton wool. When we use with cotton and touches the cornea, it produces blinking of the eye, or it closes the eye. So corneal reflex can be studied by touching the cornea of the eye with a cotton wool or whips and observing whether the rabbit blinking the eyelid or not. Check the both control eye and test eye. Then effects of pupil size. What will happen? This is the normal eye, and this is the increase the pupil size. Here you can see this is the increase the pupil size after adding drug. What will happen? That this dilatation of the pupil after adding drug solution is observed and compared with the diameter of the pupil size by using pupilometer. So we have to check both eyes whether increased or not before practical, and after adding drug there will be increase of the pupil size. So it is called mydriasis. Here you can see this is the normal pupil size, and after adding the drug into rabbit eye, it produces mydriasis. It increases the pupil size. Dilatation of the pupil is called mydriasis. You can see reflexes. This is the normal eye. It produces mydriasis, and right reflex, it is absent because we cannot see here. It does not, atropine does not show any light reflex because it blocks. It is anticholinergic drug. It produces, it blocks M3 receptors. So light reflexes is absent in this, and blinking of the corneal reflex is present in this practical mydriasis. So here you can see observation table. You have to draw in your records serial number, time, size of the pupil, light reflex and corneal reflex. And size of the pupil we have to check before practical and after practical. Light reflex we have to check before practical, means before adding drug and after adding drug. This is the control eye and this is the test eye. Corneal reflex also we have to check. And first 0 minute we have to check both pupil size, that is a control eye and the test eye, right and left eye, both eyes we have to check. On normal pupil size is 6 mm, and after installation of drug we have to check light reflex and corneal reflex, and after 5 minutes diameter size will be increased and all reflexes are present, and after 10 minutes diameter also will be increased is there, but light reflex is absent because of M3 receptors blocked by atropine. Atropine is an anticholinergic drug. It causes the blockade of the M3 receptors, so does not show any light reflex. And corneal reflex present, it is blinking when we touch with cotton wool on cornea, it blinking the eyes, so corneal reflex is present. And gradually up to 20 minutes we can add 5 minutes interval, so we can get diameter of the pupils, pupil will be increased and light reflexes is absent in mydriasis. So you have to draw in this observation table in your records. So the discussion part also you can write in your records. You have to write in your records. First one is the pathway of light reflex. It is a reflex that controls the diameter of the pupil size. When light passes through eye, this pupillary light reflex constricts the pupil by the innervation of the iris sphincter muscles. When it passes through eye, the pupillary light reflex constricts. Already we discussed in earlier first slide, because compared with dim light and bright light, when we focused on bright light on eye, it constricts the pupil size. So it constricts the pupil size. This is called light reflex. When light passes through eye, this pupillary light reflex constricts the pupil by the innervation of the sphincter muscle or circular muscles. Coming to the pathway of light reflex, when we'll show the light on eye, it stimulates optic nerve and optic tract, pretactal nucleus and superior caliculi. So in this, it stimulates Edinger-Westphal nucleus, and this Edinger-Westphal nucleus is stimulates ciliary ganglion and it acts on short ciliary nerves and oculomotor nerves. It causes constriction of the sphincter pupillae, so it causes meiosis. So this is the direct light reflex, and after the stimulation of optic nerve and optic tract, it acts on activation of contralateral Edinger-Westphal nucleus. This is the indirect light reflex. It acts on ciliary ganglion and sphincter pupillae. It acts on short ciliary nerves. It causes constriction of the pupil. So this is it also produces meiosis. This is called conceptual light reflexes or indirect light reflex. This is the pathway of light reflex. Then another one is the corneal reflex. Corneal reflex, how it will happen? When we'll touch the cornea with cotton wool, the reflex is mediated by the nasociliary branch of the ophthalmic division of trigeminal nerve. This trigeminal nerve stimulates trigeminal ganglia and facial nerves. It causes blinking and closing of the eye by stimulation of the cornea. When we touches the cornea by using cotton wool, so this reflex is mediated by nasociliary branch of ophthalmic division. It stimulates trigeminal nerves and facial nerves. So these nerves causes blinking of the eye or closing of the eye. This is called pathway of the corneal reflex. So what are the drugs causing mydriasis? What is mydriasis? It is the increases the pupil size is called mydriasis. So in the which drugs it causes mydriasis? Usually atropine, anticholinergic drugs and adrenergic drugs causes mydriasis. It produces dilatation of the pupil. It increases the dilatation of the pupil is called mydriasis. So anticholinergic drugs are cyclopentolate, atropine, hometropine and cyclopentolate and tropicamide, and adrenergic drugs are epinephrine, phenylephrine and cocaine. These drugs are produces mydriasis. For contraction of dilatation, how it will produce it? Contraction of the dilated pupillae. So what will happen? When it will contract dilated pupillae, radial muscles, it produces, increases the pupil size. So it produces mydriasis. Alpha-1 adrenergic agonist, that is phenylephrine, it produces phenylephrine, it produces mydriasis. And for relaxation, there is two ways to produce mydriasis. One is the one way is the contraction of the dilated pupillae or radial muscles. When it contracts the radial muscles or dilated pupillae by acting on alpha-1 receptors. It is sympathetically as innervated here, and it acts on alpha-1 receptors which is present in the eye. So it produces dilatation of the pupil. This is called active mydriasis. And like that, for relaxation of the sphincter pupillae, means for example, there is two ways. One is the contraction of the dilated pupillae, it will produce mydriasis, and relaxation of the sphincter pupillae or circular muscles, it produces mydriasis. This is passive mydriasis. This is called passive mydriasis. It produces anticholinergic drugs like atropine, hyoscine. This atropine because it blocks M3 receptors. This is the anticholinergic drugs. It blocks M3 receptors, so it produces mydriasis. This is called passive mydriasis. Then you can see here, this is the mechanism of action of the mydriasis. One, ephedrine, means alpha adrenergic drugs. This is the normal eye. Sympathetic drugs always acts on long ciliary nerve, and parasympathetic drugs acts on short ciliary nerves. And here you can see how it will happen mydriasis by using ephedrine or alpha adrenergic drugs. It is these drugs acts on dilated pupillae or radial muscles. Its contraction of the radial muscles, it produces mydriasis. It acts on alpha-1 receptors which is present in the eye. So it by alpha-1 receptors which is present in the eye, it binds to the ephedrine. It binds to the alpha receptors in radial muscles in alpha receptors, to which the radial and the sphincter muscles dilate and pupil size get increased, causing mydriasis. So here what will happen? How it will occur? By using alpha adrenergic drugs, it causes contraction of the dilation of the pupil. So when it contracts the dilation of the pupil or dilated pupillae or radial muscles, so it increases the pupil size. So this is the one way. This is called active mydriasis. When the contraction of the dilated pupilla or radial muscles by using ephedrine or sympathetic drugs, it acts on alpha-1 receptors which is present in the eye. These receptors acts on the dilated pupillae. It constructs the dilated pupillae and it produces increases the pupil size, is called mydriasis. This is called active mydriasis. And here you can see atropine, relaxation of the sphincter pupillae. Relaxation of the sphincter pupillae or circular muscles by using antimuscarinic or anticholinergic drugs. Atropine is a competitive antagonist of acetylcholine. At muscarinic receptors, it binds to the muscarinic receptors and inhibits the action of acetylcholine on these receptors in the sphincter muscles. This causes paralysis of the sphincter muscle and resultant increase the pupil size. Because atropine is an anticholinergic drug, it acts on it blocks the M3 receptors and it causes relaxation of the sphincter pupillae. When it relaxes the sphincter pupillae, it increases the pupil size. It is called passive mydriasis. So this passive mydriasis, how it will happen? This mydriasis, this is atropine. This paralysis the sphincter muscles. So pupil does not show. Here pupil does not show light reflex also because it blocks the M3 receptors. And another drug, lignocaine, it is a local anesthetic agent, hence corneal reflex are lost if lignocaine. If we can install this lignocaine, we cannot see corneal reflex because it is a local anesthetic agent. So when we installed in this corneal reflex, we can see corneal reflex by using cotton wool when we touch the cornea. So it does not produce any corneal reflex by using if we will install lignocaine. It do not produce any effects on pupil size. It inhibits the touch reflex but gives positive sign on the light reflex. The lignocaine, it shows light reflex but corneal reflex touch do not show any corneal reflex. Corneal reflex is absent when we will install lignocaine because it is a local anesthetic agent. Example, lignocaine and cocaine. And mechanisms of mydriasis, adrenergic drugs or ephedrine and phenylephrine, these drugs when we install in right eye, it acts on alpha-1 adrenergic receptors, relaxing the ciliary muscles and it causes pupillary dilatation. It increases the pupil size. It is called mydriasis. This is the one way. You have to note down in your records this one also. Adrenergic agonists, when we install give adrenergic agonists like ephedrine and phenylephrine, it acts on alpha-1 receptors and it causes relaxing of the ciliary muscles and it causes dilatation of the pupil and increases the pupil size. It is called mydriasis. And another one is the cholinergic cholinergic antagonist drugs. It blocks the action of acetylcholine on M3 receptors in eye. So avoid contraction and cause dilatation of the pupil. When normally acetylcholine acts on circular muscles, it causes constriction of the pupil. Like this, so cholinergic antagonists are blocks the M3 receptors. It causes it blocks M3 receptors. It avoid contraction and it causes increases the pupil size. It causes dilatation of the pupil and pupillary dilatation. So it produces mydriasis. Anticholinergic drugs produces mydriasis. So this is the passive mydriasis. And here you can see this chart. We would be given in your exam like this chart only. So you have to write everything. First you have to identify whether it is mydriatic or meiotic. Then you have to write aim materials required, procedure, and you have to write discussion part and you have to explain all this whether increased pupil size or pupil size or not, and you have to explain about light reflexes and corneal reflex in your exams. So here you can see this is the left eye as a control and right eye as a test eye. We can take like that, and in 0 minute we have to check all the reflexes whether pupil size before practical is the 0 minute. So we have to check all both eyes whether how much pupil size, for example 6 mm, and left light reflexes also we have to check light reflexes present. And after 5 minutes installing drug, we have to check left. Here we can add install normal saline. because it is a control eye. And in test eye, we can add atropine or ephedrine. So light reflex, we can observe light reflex. Light reflex also present after 10 minutes. What will happen after 10 minutes? Here you can see this is the normal light, and you can see before also little diameter pupil size will be increased, and after 10 minutes diameter of pupil size will be increased. You can see here increase the pupil size, and normal eye light reflex is present, and light reflex is absent when we'll give atropine because it blocks the M3 receptors. So it does not show light reflex. Light reflex is absent in mydriasis and corneal reflex is present. So here you can see diameter it's greater than 8 mm in mydriatic, normal 6 mm. In miotic, less than 2 mm is in test eye. It produces like that, and in mydriatics it produces dilatation of the mydriatics is produces the dilatation of the pupil. Pupil size will be increased, and corneal light reflex is absent, and the corneal reflex will be present. So in this chart you can draw like this, and you have to write. You have to in this exam purpose we can give this chart. So you have to identify each and everything. First you have to identify whether it is miotic or mydriatic, and you have to write entire procedure, entire practical aim, materials required, procedures, and discussion part also you have to write, and you have to explain light reflexes and corneal reflexes. Then conclusion, the given sample may be mydriatic drugs because it produces increases the pupil size. What are the mydriatics? Sympathomimetic drugs and anticholinergic drugs. Sympathomimetic drugs such as adrenaline, ephedrine, phenylephrine, and the dipivefrin, and local anesthetic is the cocaine. And anticholinergic drugs, atropine, hometropine, and tropicamide and cyclopentolate. Tropicamide, now hometropine, atropine we cannot use in practical because it half-life, it has a long half-life. It takes 6 to 7 days. And hometropine is a 4 hours plasma, 4 hours long half-life, 4 hours half-life. So we can use this in this. We can use this drug in practical. And this one is tropicamide. P is missing here. The small spelling mistake is there. So you can correct tropicamide. You can write like that, not tropicamide, tropicamide. So you can correct and write in your records. So anticholinergic drugs are atropine, hometropine, and tropicamide and cyclopentolate. So these two drugs are either sympathomimetic drugs and anticholinergic drugs. These drugs produces mydriasis by block. It produces by contraction of the dilator pupilla, radial muscles. It innervated by the sympathetic drugs. It acts on alpha 1 receptors. So it causes mydriasis. This is called active mydriasis. And like anticholinergic drugs also produces mydriasis by blocking M3 receptors. So it is called passive mydriasis. Okay. Then what are the uses? It is used to prevent posterior synesthesia and adhesions formation, and it is also used in fundus examination. These anticholinergic drugs and these drugs also used in fundus examination. So this is about mydriatics. You have to write in your records miotic practicals and mydriatic practicals. Effects of drugs on rabbit eye. Thank you.